Hello toppers, good morning everyone. And today we are going to discuss important MCQs from hematology point of view. So it's mainly regarding the common RBC appearances and their causes. So let's see in detail. So first comes the target cell. So you can see in the image, this cell is exactly like a target. Like we will be keeping target for the arrows, na? Exactly like this pattern. It is not round, so forgive me. And here we can target the arrow like this. So the same pattern. The center is central area of hemoglobin, and here is paler and periphery is also very dense. So this is called as target cell or codocyte, and this is seen in, you can remember it with the mnemonic HALT. Okay, that is H halt, H for hemoglobin C disease, A for A splenia, L for liver disease, and T for thalassemia. Okay, so this is regarding the target cells. Next. So here comes the spherocytes. With the name itself, it is very clear. It is spherical in shape. So basically, RBCs are of dumbbell shape, and because of some issues in the membrane, it may become spherical in shape, or because of some pathology, it may become spherical. So here, how the cell looks like. It is a dense cell and no area of central pallor. We used to expect pallor here, but here there is no pallor, and the cell is also very dense and spherical. And this we can see in case of hereditary spherocytosis, autoimmune hemolysis, post splenectomy, and disseminated intravascular coagulation. So here this hereditary spherocytosis, there is problem in the proteins in the membrane of RBC. So here there will be some membrane proteins which maintains the RBC in dumbbell shape. So for example, here in case of hereditary spherocytosis, there will be problem in ankyrin and spectrin, which is present in the membrane of RBC. Because of the defect in these membrane protein, the RBC loses its shape and becomes the spherical. Okay, and then autoimmune hemolysis, sure. And then in case of post-splenectomy and DIC, so these are all the pathological condition which leads to the formation of spherocytes. So now it is normoblast, none other than nucleated red cells. So in order to understand this, you should know something regarding the erythropoiesis. So here what happens, from the pluripotent stem cells, we will be having myeloid lineage and lymphoid lineage. We are not discussing in detail lymphoid lineage. And here in case of lymphoid lineage, we will be having B lymphocyte, T lymphocyte, and natural killer cells. But in case of myeloid lineage only, our erythroblasts, platelets, all the granulocytes will be forming. So we are focusing mainly on the erythroblast. First comes the proerythroblast. Then it transforms into basophilic erythroblast. And then it transforms into normoblast. And here in case of normoblast, like in all the RBC cells, we will be having nucleus. Like in all the precursor cells, we will be having the nucleus in center like this. We will be having nucleus. So in case of normoblast also, we will be having nucleus in the center. And finally, this normoblast gets converted into a reticulocyte, where there will be no nucleus in the RBC, and this reticulocyte is finally converted into RBC, which is also non-nucleated. So in case of normoblast, it is none other than the nucleated red blood cells, and this normoblast is none other than the precursor of RBC. So it is seen in marrow infiltration, myelofibrosis. So basic problem is, whenever there is any problem in the bone marrow, that will lead to the problem in the hematopoiesis, and mainly in erythropoiesis, it is leading to normoblast. And in case of severe hemolysis, we can expect in order to compensate, our body will try to do large amount of erythropoiesis, but there is the quality, because of the lacking in the quality of erythropoiesis, it will lead to the excess production of normoblast. Havel-Jolly bodies, and here in case of RBC, we will have some small round nuclear remnants. You can see in the image, we can see the small round nuclear remnants here and there. So this is mainly seen in post-splenectomy, hyposplenism and dyshemophosis. So this is regarding the Havel-Jolly bodies. So here you can remember this condition with the help of mnemonic PhD. So remember that Havel-Jolly bodies were going for PhD studies. So P for post-splenectomy, hyposplenism and dyshemophosis. So now comes basophilic stippling. So everyone knows basophil is of blue color in shape. So here there will be abnormal ribosomes which appear as blue dots. Okay. So here in image it is little bit pinkish in color. Just forgive me for that. And here we will be having the abnormal ribosomes, as you can see in the image. Imagine it as blue color, that is more than enough. There will be dots inside which were blue in color, and they were the abnormal ribosomes as blue dots. So that is seen in thalassemia, anemia of chronic disease, iron deficiency and lead poisoning. So it is more pathognomic for lead poisoning cases. Next. So here comes the helmet cells. It is also called as cystocytes, and it is seen in DIC, that is disseminated intravascular coagulation, where we will be having both the thrombus and hemorrhage. And here in case of TTP and HUS, there will be non-immune mediated hemolysis. So here TTP is none other than thrombotic thrombocytopenic purpura, and HUS is nothing other than hemolytic uremic syndrome. So next comes bursitis, which is seen in TTP and HUS, that is thrombotic thrombocytopenic purpura and hemolytic uremic syndrome. And here in this image you can see the bursitis shape of it, and this is also called as echinocyte. Okay, next. Then comes teardrop cells. You can see in the image, it is exactly like a teardrop. Yes, exactly the same. And it is also called as dacrocyte, and it is seen in myelofibrosis. So here in case of myelofibrosis, we will be having dry tapping. So here what happens basically, there will be fibrosis inside the bone marrow. So whenever we are doing bone marrow aspiration, we won't be getting anything because of the fibrosis inside, leading to the dry tapping. And along with that, we will be having teardrop RBC cells. Comes bite cell. So it is exactly like a Apple logo. In the RBCs, there is some bitten spots. You can see here. It is as if someone had bitten it, similar to our Apple logo. Then it is seen in G6PD deficiency. Okay, doctors, happy learning. Try to remember these things. This will be asked as direct MCQs sometimes.